The average American family now pays $27,000 a year for health insurance. $27,000. That number does not include deductibles, copays, prescriptions, or the bills that arrive anyway, because your plan decided that what your doctor recommended was not covered. Over a working lifetime, a single family will spend somewhere between $800,000 and $1.2 million on health care, not on being healthy, on the system that sits between you and being healthy. In Lancaster County, Pennsylvania, the Amish do not carry health insurance. They do not participate in Medicare or Medicaid. They are legally exempt from the Affordable Care Act and have been exempt from Social Security since 1965. And yet their medical bills get paid, every single one. Their families do not lose their homes because someone got cancer. This video shows you exactly how their system works, what it costs, and why the insurance industry has spent 60 years making sure you never heard about it. A $27,000 health insurance premium. That's the bill for a single family every year before you even step foot in a doctor's office, before a single prescription, before you pay a dime in copays or deductibles. For most Americans, this number arrives as a shock. But it's not a typo. It's the average, and it's climbing faster than wages, groceries, or rent. Now, stretch that cost across a working lifetime. Do the math: 40, maybe 45 years of premiums, out-of-pocket bills, surprise charges, and denied claims. The total? Somewhere between $800,000 and $1.2 million. That's the price of a house. Or two. It's money most families never see, siphoned away bit by bit, year after year, into a system that's supposed to protect you from financial ruin, but too often delivers the opposite. Zoom out. The United States spends $5.3 trillion a year on health care. That's 18% of the entire economy, almost 1 in every $5 generated in the country. Yet for all that spending, Americans still face medical bankruptcies, skipped treatments, and endless paperwork. No other developed country comes close. Switzerland, Canada, the UK, they all spend less per person and get better results. Where does it all go? Not to doctors or nurses, not to miracle cures. A quarter of every healthcare dollar vanishes into administration, billing, insurance claims, and the endless back and forth that comes with third-party payment. Every extra layer means more cost, less clarity, and less control for patients. The more middlemen, the bigger bill. This is the modern reality. A system where you can pay $27,000 a year and still wonder every time you get sick how much of the bill will actually be covered, where the price of care is hidden, negotiated in secret, and almost nobody pays the same rate. It's a maze built on confusion and fear, with the insurance industry at the center taking its cut. Meanwhile, there are communities in America that pay a fraction of this. They know every dollar spent, every bill negotiated, every neighbor who needs help. The difference isn't just in dollars, it's in who holds the power and who knows the true cost of care. 100 years ago, almost every American paid the doctor directly. Cash on the table, bills settled, no middleman. 90% of all medical care was handled this way, face-to-face, in dollars and cents, with no insurance company in the room. If you couldn't pay, you worked it out. If you needed help, your neighbors passed the hat. Prices were low, and everyone knew what things cost. That all changed in 1929, when a group of Dallas school teachers and Baylor Hospital struck a deal. 50 cents a month, less than the price of a haircut, bought you up to 3 weeks in the hospital, no questions asked. The Baylor plan was simple. Prepay a little, get care when you need it. No claims, no paperwork, just a handshake and a ledger. Within a year, thousands of teachers signed up. Hospitals across the country copied the idea, and by the late 1930s, the Blue Cross name was everywhere. Flat fees, community-run, and everyone paid the same rate, sick or healthy. Then came World War II. The government froze wages, so companies started offering health benefits to attract workers. The National War Labor Board gave the green light. Health insurance didn't count as a raise. Employers jumped in. By 1945, 1 out of every 3 private sector workers had coverage through the job. What started as a workaround quickly became the default. Insurance companies saw a gold mine. They moved in, took over, and rewrote the rules. Prices lost all connection to reality. Now, nobody, not the patient, not the doctor, knows what anything actually costs. Bills ballooned, discounts got hidden, and the simple cash model disappeared. Historian Laura Parker puts it plainly. When you pay the doctor yourself, you care what it costs. When someone else pays, you don't ask. That's how prices run wild. The Amish never made that switch. Their system still runs on cash, negotiation, and mutual aid. Direct payment, full transparency, and every dollar accounted for. It's not nostalgia. It's a working alternative, buried by the insurance industry's rise. Inside Amish hospital aid, the rules are simple, the numbers are public, and the results are hard to ignore. Each adult pays about $30 a month. No fine print, no annual premium spikes. The fund sits in a local account managed by neighbors, people like Dan Yoder, who signs every check and negotiates every bill. There's no corporate office, no claims adjusters, no endless phone trees. When someone lands in the hospital, the process kicks in. The bill comes straight to Dan, who calls the hospital's billing desk and offers cash, real money, delivered within 10 days. The deal? A 50 to 70% discount locked in before the check is cut. Hospitals take it every time. Why? Because cash in hand beats waiting months for an insurance company to maybe pay, minus their own discount, minus whatever they decide isn't covered. Here's what that looks like in real life. Dr. Eli Katz at St. Luke's Hospital pulls up a recent invoice. The sticker price for a routine surgery, $4,200. The Amish hospital aid check, $1,250. That's it. No haggling, no appeals, no denials. The hospital gets paid in full by their own definition without chasing debt collectors or fighting over codes. The patient's name, the amount, the date, all logged in a ledger the whole community can see. Everyone knows where the money goes, and every bill is a reminder that the fund belongs to the people paying in. This system isn't charity, it's mutual aid, engineered for speed and savings. Every 10 days, the cycle repeats. Someone gets sick, the fund pays, the hospital discounts, and the ledger updates. The average Amish family sees their share of costs slashed by more than half, sometimes 2/3. No one is left guessing what a procedure costs or who's footing the bill. It's all out in the open, and it works because everyone has skin in the game. The result? A healthcare engine that runs on trust, transparency, and the power of cash, while the rest of America waits for the next denial letter. Inside an Amish home, the medicine cabinet doesn't start with a bottle of pills. It starts in the garden. Willow bark, elderberry syrup, comfrey leaves, these aren't old wives' tales, they're frontline tools. Willow bark tea packed with salicin works like aspirin but costs pennies. Elderberry syrup, 2 cups of berries, 2 cups of honey, simmered for 45 minutes, bottled for the winter. It's the go-to for cold and flu season. Comfrey leaves, crushed and wrapped on a bruise, help joints heal faster. Every remedy comes with a story, passed down at the kitchen table, not handed out at a pharmacy counter. This isn't about avoiding doctors. It's about using them only when it matters. The numbers are blunt. Amish families make 80% fewer routine doctor visits than their non-Amish neighbors. That's not because they're skipping care. It's because they're handling the small stuff at home, saving the fund for real emergencies. When someone does need a hospital, the bill goes to the community, not an insurance company. And everyone knows what it costs. There's another layer here: accountability. Every time a bill lands, the whole community sees it. Elective surgeries? People think twice. A 2023 survey found that 90% of Amish adults trust their neighbors to help pay, but they also know the money isn't unlimited. That kind of transparency changes behavior. It's not just about herbal teas, it's about restraint. When you know every dollar comes from your neighbor's pocket, you don't chase every test or procedure. You ask, is this worth it for all of us? That's the quiet force keeping costs low and trust sky high. No premiums, no fine print, just cash on the barrel and neighbors who see every dollar spent. The Amish aren't anti-medicine, they're anti-middleman. Their system exposes what $27,000 a year buries: price distortion and lost trust. Which piece would you try first? Drop your answer below. We're not done yet.